I never probed hard enough back when I was at a teaching hospital. It's an amazing academic center with the head of high risk, the head of perinatology. And, I remember asking her one time, like, bad luck, huh? What does that mean? And she said, it's just we don't always know. And that's kind of where we parked it.
Mm-hmm.
And I never felt satisfied by that answer. And in some ways, I think one of the most therapeutic parts of writing Fertility Rules for me was writing the chapter on eggs, because no one had ever explained it to me in a simple way.
Welcome to Baby or Bust. I'm your host, Dr. Lora, Shahine, and I am tired of infertility and miscarriage being misunderstood, hidden, and full of stigma. Welcome to the podcast with interviews and in-depth discussions on topics all things fertility. Thank you to our friends at Seattle Sperm Bank and Greg Moga for sponsoring the show. Please take a moment to give us a 5-star review anywhere you listen to your podcast. It really helps other people find the podcast, and it just means so much. Finding reliable resources for questions about fertility and pregnancy can be challenging. We certainly did not learn about ovulation, IVF, and egg freezing in health class. Turning to friends and family can feel too personal sometimes. Time with your doctor is limited, and it's easy to forget those questions that you really wanted to ask. Google, YouTube, Instagram, everything seems to say something just a little bit different. Wouldn't it be nice to have a fertility Siri? You could ask your question and get a response anytime you needed it. Or even better, that tech friend that could be a real friend that could text you anytime, answers, day or night. Well, Leslie Schrock is that friend and self-described fertility Siri. After struggling with multiple miscarriages and infertility in her mid-30s, with ups and downs and everything in between, she has 2 boys and something to share about a modern approach to fertility and pregnancy care. She has authored 2 books, Bumpin, The Modern Guide to Pregnancy, and most recently, Fertility Rules, The Definitive Guide to Male and Female Reproductive Health. Leslie, welcome to Baby or Bust. I'm so excited to have you here.
I'm so excited to be here. This is a thrill for me. I love it when we get to talk.
Oh, thank you. Well, I remember when I got in the mail a copy of your book. So this happens to me a lot. A publisher sends me a copy of a fertility book. Can you read it? Can you post about it, online? What do you think? And I do read them. Like, I want to help other authors. But yours was different. I was reading through it, and honestly, Leslie, I felt like I was reading my own thoughts. Very balanced information. So much information comes at fertility patients out of fear. Like, this is what you should be afraid of. This is your problem, and I'm going to sell you the solution. I felt like it was, kind of like a friend teaching me a little bit about their personal story and the balanced information of like, well, some doctors say this and others don't. And I just knew it was really different and I enjoyed it so much. And I reached out, and now I reach out to you all the time. So thank you for always replying to my emails, and just really, it was really, really different. And I wanted to make sure that you know that.
Oh, that means a tremendous amount to me, especially since I really respect the medical community. And what I'm really trying to do is build a better bridge between patients and providers. And that's not always a message that can be delivered by a provider. And so I'm just doing my best to, share clinically validated, research-backed information in a way that, people enjoy reading, because I think this topic is so fraught and emotional and exciting and interesting. And it's so, the research is so nascent that there is so much to know, but it's important to also acknowledge what we don't know. So it's a real privilege getting to do the work that I do.
I know how hard it is to write a book. You can have an idea and you can start writing thoughts down, but to actually put it into a book, put it out there, it takes so much work. You went from angel investor to fertility treatment mom and author. And I'm just curious, we usually end the podcast with a fertility story, but I think your fertility story really seems to have been the inspiration behind these books. And I would just love for you to share your story.
So I've now spent well over a decade of my life working in health as an investor, as a creative director, as an advisor to some of the top companies now in women's health. And like I said, what I get to do all the time, writing and not, is such a privilege. But part of that privilege is having access to so many great people, medical providers, experts from all over the world. And so when it was my turn to get pregnant, I thought to myself, everybody does this. It'll be easy. It'll be fine. I knew about miscarriages and I knew the basics, but never did I imagine that what was about to happen to me would happen. And so we started our journey to try to conceive. And 5-6 weeks in, I had my first miscarriage and it resolved on its own. It was, early enough, but it was just shocking. Like, wait, I had this thing and then it was taken away. And, I didn't have a whole lot of time to process it because 2 weeks later, we were one of those couples whose problem wasn't getting pregnant, it was staying pregnant. So I got pregnant the next cycle. Mm-hmm. And that pregnancy was really the turning point for me in kind of my personal journey, because I had to have a medically necessary abortion. We had a chromosomal abnormality. We had trisomy 18. It's a fatal condition. Our situation, it was very clear that the pregnancy was going to end very shortly. And, it was the hardest experience of my life. Here I am facing this, it wasn't a choice for me. I had to face this procedure that I absolutely didn't want, but I had to have it. So that was really what inspired me to start to write. I, ended up meeting my publisher when I was pregnant with my now 4-year-old son. And I just said to her, I can't believe that this is how we are talking to families in this day and age about pregnancy. There's nothing practical in here for people. It all kind of feels fluffy. And it also feels very binary, as if every single person who is pregnant greatly enjoys the experience and it's just sunshine and puppies all the time. And any of us who have been pregnant know that it has its ups and downs, even if you have an easy pregnancy. Just like being a parent, ups and downs are part of the thing. And so I looked around and said, no one else seems to be doing this, and I feel alone and angry enough about the fact that, no one's openly talking about the fact that, A, what happened to me could happen, but also talking to me in a respectful way that, gives me the information I need without a bunch of scary jargon or a bunch of like, you go mama fluffy stuff that I didn't really relate to. We all need a little bit of that, but maybe not all the time.
Yeah.
So I just aim to be a straight shooter. At this point, I've conducted hundreds of interviews with providers, complementary practitioners, pelvic floor experts, reproductive endocrinologists, midwives, OBs, doulas, like you name it, I've probably talked to that person, supplement makers, nutritionists. So I've really taken a journalistic approach to writing, just conducting a lot of interviews, doing my own primary research. I've had fabulous medical editors, across both of my books. But I fortunately welcomed my, my first son. That journey was not without its twists and turns too. I had a pretty difficult birth with him. Breastfeeding didn't go so well, and then I had a missed miscarriage between the births of my 2 kids, which also was kind of shocking. So really, to me, it feels like we're making progress in talking about these aspects of starting a family more openly now, but still not openly enough. And so my goal and my mission is just, with my writing, if I can help a few people feel less alone when they're going through something hard, or if they're going through something happy and they just don't really have the same relationship with it that they see on the internet, that I will have succeeded.
Oh, well, you're absolutely doing it. And I appreciate your curiosity. I see that in your writing and I see that in your interviews. And whenever we interact, I feel like you want to get the information, but in a balanced way and kind of know the facts, but also realize that there's a lot of feelings involved. So it's nice to have writing from somebody that maybe isn't as cold as some other like medical writing that is out there. I know that when I was going through my pregnancy, I was an OBGYN, but I also read like the what to expect when you're expecting. And, even as an OBGYN, that book scared the crap out of me.
Same.
I was like, I'm having a little bit of pain in my, abdomen. And it's like, well, you could be having a miscarriage. You could have appendicitis. I mean, yes, these things are true. But I really did honestly never feel reassured by reading that book. And it sort of felt like it was either that or, like you said, just kind of the fluffy, oh, pregnancy is bliss and isn't a miracle of life and aren't you glowing and isn't it great? And especially after struggling with infertility, struggling to get pregnant with both of my kids, I felt very guilty about not feeling 100% positive all the time. Like I didn't feel that I had the permission to complain about it. And I just never felt that any sort of shame or any sort of expectations are put on people when they're reading your writing. And I really appreciated that.
Thank you for that. I think that this is another thing that we really need to destigmatize, because fertility patients and those who, go through miscarriages, oftentimes we do feel like, well, we're so lucky that we're pregnant and we're so lucky to be welcoming this life. And that doesn't mean you can't still feel your feelings. You can still feel like, wow, this acid reflux, I could really do without this. Or, wow, I really don't like the smell of anything right now and I can't even enjoy my food. And you know what? That's not particularly great either. And multiple things can be true at the same time. But I think, it's important to acknowledge that fertility patients struggle with more anxiety on average than, those who don't have difficult conception journeys. And it's normal, but it's very important that you talk about it. It's very important that you find your way, whatever that way is, to manage it. Because that's another thing that I really dislike about a lot of what's out there right now in the fertility community, especially, is like, well, you must do prenatal, you must do yoga, or you must, just do breath work. And yes, those things are amazing. And also they're not for everyone. So I think this whole idea that there's one right way to do it is something I actively fight.
Right.
Except things like don't smoke. Just please don't smoke.
It just reminded me of there's some memes out there where it's like yoga can fix everything. And it's sort of like, oh, you're stressed, do yoga. Oh, you're having a bad day, do yoga. You have infertility, do yoga. You're having chest pain, do yoga. No, you might be having a heart attack. It's, you went through so much in your family building journey. You went through many different types of miscarriage, loss, grief, struggles. And I definitely see two different types of people after the fertility journey. Those people that want to shut the door, close that box, compartmentalize, and just never think about it again. And then another group of people that are like, wow, I really kind of need to process that. I need to sort of learn a little bit more about what happened to me. And I also want to share that knowledge with people, whether it is friends, whether it is an audience that's reading a book. And you seem to be one of those people. And those are the type of people that I'm interviewing on this podcast, right? The people that go through infertility and then they host their own fertility support group or their own, yoga for fertility. Nothing against yoga. I absolutely love it. But you didn't shy away from it. You took this really very significant struggle and you're actually trying to help others. And I just think that's really beautiful. And I'm wondering if in writing, researching, interviewing, you were processing or you were trying to find answers to what you went through too.
Yes, 100%. It is therapeutic in some ways.
Yeah.
I mean, there were times when I would write something and I would burst into tears. There were times when I would write something and I would have to take a deep breath and stop for a few minutes and go take a walk because reliving it was really painful. And I think, one of the things, I get a lot of notes from readers and I love it and I try to respond to every single one when I can. But I have had some very pained notes from people who say, I read what you went through. I went through it too. And thank you. I know that couldn't have been easy to write. And that makes it feel very worthwhile. But I think one thing that's kind of a through line to my career, which if you look on LinkedIn, it's a little random and it's a little all over the place and it's got a lot of really wonderful highs. But I think I am the type of person, when I see something wrong in the world, I want to do something about it. And I want to make things a little better for everybody who came after me, including my kids, which really, inspired me to write Fertility Rules in a lot of ways. But also, if I had all of these questions and I was going through this struggle and I had all of these incredible experts at my fingertips because of my work, what was it like for everybody else? And, not even getting into the state of maternal mortality in this country, which is something I'm very active. I actually just joined the White House HHS task force on maternal health. And, I'm working on a mental health committee right now, and I'm really trying to help, do something, because
Fantastic.
Yeah, because it's easy to sit back, and for some people it is survival, right? I understand people who put it in a box and put it on a shelf. I've certainly done that plenty in my life, but I think that this was something that I felt that I could contribute, that I could do something.
Absolutely. And you did. You truly did. The thing that I take away from reading actually both of your books, but specifically the Fertility Rules, is your dedication to busting myths. And man, is fertility full of incredible myths. You talk about wanting to be your friend's fertility Siri. I love that, where you're like, yeah, ask me questions. I'll help answer. I'll help bust myths. You read something on Instagram, ask me. I'm a wealth of information. And so I just wanted to clarify some of the myths that you do such a good job of busting in Fertility Rules. So myth number 1, fertility is a woman's problem. What do you think?
This is probably my favorite. I love all of the myths that I get to bust in that book, but this is probably the one that I think, if I can be successful here, this is the greatest service I can do to women who today are treated. Women are acting as treatment surrogates for men.
Okay, explain that.
So if we know that 1 in 5 couples gets pregnant naturally after going through IVF, one can assume that there is overtreatment happening. And some of this is treatable. But the other issue is, let's just be honest, and this is something that came up in my research a lot, not every single fertility clinic treats men or even tests them at the outset of a fertility journey. And this is something that is very difficult, because I speak to a lot of incredible reproductive endocrinologists who are like, not on my watch. And I certainly hear a lot of stories from patients who say, well, we didn't know about my husband's sperm concentration until we went to fertilize those eggs. And I think to myself, this seems very crazy, because men are responsible for around half of all infertility. So around a third of the time, it's exclusively women. Around a third of the time, it's exclusively men. And around a third of the time, it is unknown or a combination, because that's right. Just because you might have some issue doesn't mean your partner doesn't too. And unlike women, who once, an egg is chromosomally abnormal, you can't do anything about that. Men oftentimes can reverse certain types of issues with their sperm. There are also conditions like varicoceles, which can be dealt with. That's, there are veins and so you know what all these things are. There are issues with men that can be treated. And a lot of it's just lifestyle.
Yep.
Women, same, but men, really, it's much easier for them, for sure. It's like, what do you see in clinic?
Oh, well, this is one of the things when I was reading your book, I was like, okay, I've been saying this forever. Men need a seat at the infertility table.
Amen.
And it plays into the whole assumption that anything surrounding family building is the woman's issue, the woman's problem. If you can't get pregnant, it's got to be the woman's problem. Well, guess what? We thought forever that the sex of the baby was determined by the woman, but it's actually the sperm, right? So I wish we could have told Henry VIII that and saved some of his wives. But so there's so much assumption that it's a woman's fault. And guess what? That's left men out of so much, left them out of research, left them out of, kind of the conversation, even the emotional part of fertility and miscarriage. There's such a disservice, and they're half of the genetic equation. So yes, when I read a lot of your call to action, understanding for men, I have a whole chapter in my book on miscarriage and recurrent pregnancy loss for men, But guess what? It's a really short chapter because there's not a ton of research. There's not a ton of testing, and it needs to be paid attention to because they are absolutely half of this issue. So thank you.
Yes. And if your partner doesn't want to go to the clinic with you and have a semen analysis, remind him that it's a non-invasive procedure that involves watching something pleasurable and doing something rather pleasurable, as opposed to women where it is much more invasive and much more, expensive. Also, semen analyses are freaking cheap, guys.
Yeah. Less than $200 in most clinics. But I think also, please don't make the assumption that just because you've caused a pregnancy in the past, that you are still fertile. I mean, sperm counts change with age, with illness, with chronic illness, with medications that you're taking. And I can't tell you how many men are being put on testosterone these days for low libido or low energy. And testosterone will absolutely act like a contraceptive. It will decrease the production of sperm. And so many people don't know that. So please get a semen analysis. Both Leslie and I agree very strongly on that.
And stop smoking pot, because that's going to work your sperm too. This is another one that shocks people.
Yes.
What do you mean THC messes up sperm parameters? Yes, it does. We don't really know with CBD, but you know what? You should just stop both if you're planning to try to conceive.
It gets really pretty sensitive when I counsel about that because there's such an assumption that it's natural. It's a plant. Doctors prescribe marijuana for nausea and chemotherapy. It's got to be safe. But really, truly, I did a whole YouTube video on this, on marijuana and men. Absolutely proven to decrease sperm motility, morphology, count. And of course, your friend down the street that smokes twice as much as you do and has like 5 kids. Okay, that's that person, but you are a different human, and marijuana could be impacting you differently because it does for most men.
Yep. It is hard to talk to people about, and it's hard to talk about, steroid use, testosterone use. Steroid use can be also very difficult, especially if a man has been on it for a long time. This is something that came up in a lot of interviews that I did, was that, there are some cases where a man has been using it for the majority of their adult life. Mm-hmm. And one of my favorite interviews actually was with a doctor here in New York who told me about a guy that he was like, this guy is like emblematic of a lot of people that come into my clinic. He came in, and as soon as he walked in, I knew the problem. I knew immediately that he was taking steroids, but I don't think his partner did. Mm-hmm. And so she left the room to go get some blood taken, and he tried to have a conversation. Sir, is there any other medication that's not on this list? No, nothing. Sir, are you sure? You know that if you're taking steroids, you just are going to have to taper and, probably stop. Well, I'm not taking them, and I'm not tapering. And okay, well, that's going to be it. And he said it's much more common than you would think. And it's very difficult. Listen, I understand. We put a lot on men too. Mm-hmm. And there are sensitivities there, and it has to be managed in the right way. I don't think that, it's certainly not a cold turkey situation, but, reproductive urologists are great at managing this. They know how to do it.
Absolutely. And you can take medications to kind of bring back the counts quickly. And I've even had somebody where their whole life is really bodybuilding, and they owned a gym, and it was just like a really important part of just their career, their livelihood. And so honestly made a plan to do whatever we could to get sperm back. We froze several samples. And then honestly, he went back on, talking through all the different options. So just anyway, no shade or shame, but just the knowledge. And there are actually some doctors out there that truly don't realize that testosterone will slow down sperm count. Like, this message needs to get out there.
Yes.
Yeah. All right. So myth number 2, everybody needs to take supplements that is trying to get pregnant and has infertility.
The only supplement you need to take before you conceive, preferably 3 to 6 months before you try to conceive, is a prenatal vitamin, because folic acid is the key ingredient, and it helps to reduce the risk of neural tube defects during early pregnancy, before many women even know that they are pregnant. Which, if you're a fertility patient, I know that sounds crazy, but almost half of pregnancies are not intended. Yeah. It's also why our food is fortified with folic acid. There are a lot of companies out there pushing miracle substances that fix your eggs, and the truth is there is not any really strong evidence for any of it unless you have a specific deficiency and you've worked with a provider in order to fill that deficiency. But supplements are not magical pills. Take a prenatal. Men, you can take a multivitamin. You can take a male prenatal. Those are fine too. They're basically just multivitamins with extra ingredients, but you really don't need to take anything beyond that unless you've worked with a provider and you're treating yourself for a deficiency.
Yeah, this is something that I really appreciated in reading your book because, honestly, I picked up the book and thinking, okay, this isn't written by a medical doctor. I'm kind of curious, is this going to be some like nutrition fad? Like everyone should stop eating gluten in order to get pregnant? Is this going to tell people to use this certain supplement? And you really gave the evidence in a very balanced way. And it can feel so out of control when you are not getting pregnant or when you're having miscarriages. And you want to take back control. And it feels like taking a supplement, doing something active is going to fix the problem. And the $200 billion supplement, industry is basically playing on that vulnerability. And you do a really good job of explaining that the FDA does not regulate the supplement industry, that you cannot be 100% certain that the ingredients that are listed on the label are actually what you are taking. It's very different from prescription medication, but not shaming people for wanting to learn or kind of wanting to be interested in that. I talk to my patients about supplements every single day. And I talk about prenatal vitamin. I love vitamin D, CoQ10, Energy Power. But just really be careful. You don't have to buy a really expensive branded fertility supplement. You just want to look for something that's third-party tested because the FDA is not that third party to confirm what's in there.
Listen, I have been there. I would have done anything, to just get pregnant, stay pregnant, any number of supplements. But people spend hundreds of dollars on things that ultimately, sometimes thousands of dollars. I mean, it is wild. Some of these fertility protocols and supplement companies that say we can fix it. It really makes me angry preying on people who are in an emotional state. And I was there. I was preyed upon on Instagram and I did not enjoy it. So really there is a whole guide to how to select supplements too in the book, because I think a lot of people think every supplement is kind of created equal and it's simply not true.
All right. Myth number 3, we can always figure out why we're having miscarriages.
No, sadly, no. I know. I was told, it's just bad luck. It's just bad luck. It's just bad luck over and over again. And I think that my doctors said that to me because, we don't know for sure. I mean, I was healthy, on the outside. I ate well. I exercised. I don't have PCOS or endometriosis. I don't have any hormone imbalances that I know of. I don't have any genetic conditions that I know of. But I was 35. And I suspect what happened to me was egg quality. And that is chromosomal abnormalities, mostly driven by eggs, are what cause the majority of miscarriages. That said, there is a whole lot we don't know about sperm. And this is one reason that I am trying to The Economist asked me to write a piece on sperm. And this is when I knew the world was finally ready to start doing this because, without acknowledgement that this is a factor in infertility, without inviting men to the table, and without including them and researching sperm so that we know, nothing's going to change for women. So if there are any funders out there listening, you should fund research into sperm too, because it's in the end, women are absorbing the cost.
Yeah, I hear you. One thing that I really appreciate about your story is you talk about how it was always easy for you to conceive, but you just couldn't keep the pregnancies. Everybody says it in a different way, but I had no trouble getting pregnant. I just couldn't keep it. You conceived within the first month or 2 of trying.
I did.
Each time.
I
see this, and I don't have a way to prove this, but I really do see a lot of patients like this. And I think that there are people that their superpower is they get pregnant with any embryo that comes along. And so their burden of infertility is not going for a year or 2 without getting pregnant and wondering what's wrong. But so many embryos are not chromosomally normal or have all the genetics that they need. And I think some people, their body just doesn't do a great job of the filtering. until a little bit later. I know that's a lot for people to wrap their heads around. And, I know it's hard for people out there that are not getting pregnant, but this is just a different type of infertility. And I tell my patients, I'm like, your superpower is getting pregnant. And really, every pregnancy is a new opportunity because it's a brand new egg, it's a brand new sperm, it's a brand new embryo. And most people that are getting pregnant will go on to have their family. And you really are a good example of that, even after so much heartache. And I just wonder if anybody ever talked to you about that.
No.
Yeah.
No. And I mean, I always joke that my uterus must have been pretty awesome because my first son really did not want to come out. He got stuck on the way out so that I had a C-section. And at like 41 and a half weeks, it was kind of, it was, that was slightly bonkers too. But no, I mean, this is another area where I think medicine and patients really need to do some work because I never probed hard enough back when I was, I was at a teaching hospital. It's an amazing academic center with the head of high risk, the head of perinatology. And, I remember asking her one time, like, bad luck, huh? What does that mean? And she said, it's just we don't always know. And that's kind of where we parked it. Mm-hmm. And I never felt satisfied by that answer. And in some ways, I think one of the most therapeutic parts of writing Fertility Rules for me was writing the chapter on eggs because no one had ever explained it to me in a simple way. They're like, chromosomal abnormalities in an embryo. Well, what does that actually mean? When does it happen? Why does it happen? Is there fault involved? Because any fertility journey, you always question. It's not fair, and it's frankly pretty dumb. And I say this as someone who definitely pointed the finger at myself and then secretly wondered, is it my husband's sperm? And I made him get tested after the fact. Mm-hmm. Our family is done. I actually can't have any more kids. I had a very hairy birth with my second, but I think that we have to do better in helping patients understand that part of their journey because I felt like I was up for more information than that. And we didn't have enough time in my appointment. And it's not the doctor's fault. I think people forget OBs are people too.
Yeah.
When there's a hard case, you take that home with you. And it's incredibly difficult. And you guys want more time with patients too. But unfortunately, the system is deeply flawed.
Yeah.
But yeah, I think patients deserve better than, we don't really know, but bad luck is probably the best thing we can say.
Yeah, it's hard. I think we could say something like, really it is typically an issue within the embryo, whether it's a genetic issue. Most of the time, it's a abnormal chromosome balance. But you can still miscarry a chromosomally screened embryo because we're literally just testing 23 pairs of chromosomes that have 10 to 20,000 genes on them. And incredible research is happening at Stanford, a wonderful research trial with my mentor, Dr. Ruth Lati, where she has NIH funding and she's looking at whole genome sequencing in people that have chromosomally normal miscarriages. And we're going to find smaller genetic mutations that cause miscarriage. It's true. It's called the HOPE trial. Look it up and register. But being able to say to someone, you're over 35, you're just going to be infertile. Well, no, those eggs have been sitting in your body since you were born, and they're sitting with 2 copies of each chromosome. And when you ovulate, whether you're 25 or 35, the eggs have to do all of their genetic work. And if they get rid of too many chromosomes or they hang on to too many and the sperm comes along and gives its chromosome, then you're going to have an imbalance and that embryo can implant, but it's not going to be a baby. Okay, that took me 30 seconds.
Yep.
That is my biology understanding of 20 years, but I can say it in 30 seconds. And then say, there is an age factor with men. It's just not as dramatic because they make sperm every single day and they make it ready to go. It's made with 1 copy of each chromosome. It's not hanging out in their body for, 40 years or whatever. And that's what you're saying. You're saying lifestyle optimization really can impact sperm because they really are making it every single day. That took us less than 2 minutes rather than just, it's bad luck.
Yeah. I feel like every office should have a chart of meiosis somewhere that a doctor can just say, I know you don't remember high school biology, but let me just go through this process with you because it gave me so much peace of mind because even though I had already written a book, I already knew that it probably was my eggs. I had Nick tested. I went through all kinds of other exploration. And really, that is where I ended up, especially in our situation, because we knew we had a pregnancy with a chromosomal abnormality. But I think one of the fascinating areas that I've been looking at actually is mosaic embryos, because that just proves how little we know about all of this anyway.
I know. It's amazing. Okay, myth number 4, abortion is not healthcare. I'm sorry. I know this is really sensitive, but you're so generous to share your personal story with having to terminate a very highly desired pregnancy. Termination of that pregnancy is an abortion. It's a medical term, and you needed it to be able to continue your fertility journey. I just really appreciate your sharing that, Leslie.
Yeah, and I think that as much as I am a champion of women's right to choose, I think we also have to acknowledge that sometimes it's not a choice. And for me, it wasn't. I shared at the beginning of the podcast that, our second pregnancy, we found out when we did our NIPT test that we had trisomy 18. And it was, NIPT is a screen. So
just to clarify, it's the blood test looking for fetal DNA in your bloodstream to see if there's a chromosome imbalance. And it came back that there was 3 copies of the number 18 chromosome.
Yes. And, we had no idea what it was. We had no idea that this was even like a possibility, right? I mean, we talk about Down syndrome a lot, but that's not fatal. There are conditions, however, that come back on that screen that are, and Edwards syndrome or trisomy 18 is one of them. And so we did a CVS test. I called, a friend of mine, co-founded 23andMe. I called her and I said, is this test for real? How could this be happening? And she said, oh, Leslie, yes, you need to follow up on this. And yes, it's a pretty good technology. There are some issues with it for sure. And I actually caveat that in Bumpin in the prenatal testing chapter. But, we went through a CVS test. We had an ultrasound. The ultrasound showed that, the fetus had stopped growing. We were kind of stuck back a few weeks. And, we had all the information we needed. And the doctor said, we need to terminate this. And it just made my head explode. I just couldn't believe it. And luckily for me, I lived in California at the time, where I could make an appointment and do that. That said, I still had to wait. I had to wait over a week.
I'm so sorry.
Yeah. And I mean, there is, for anyone who's out there, it is an exquisitely painful experience still being pregnant when it's not going to work out for any period of time. It happened to me between my 2 kids too. I had a 2-week period where I knew it was over, but we had to wait and, I went through all of the abortion paperwork and all of the questions and all of the things. And I both felt very lucky that I could access that care, but also, wow, this is something that nobody talks about, that it is not only not always a choice, it is just healthcare. So it's a bit scary knowing what's happening in this country right now with doctors who are not receiving the training to help in a situation like that, where it was a very wanted pregnancy. It's really painful, but I'm so happy I get to share that story because I have talked to many people who are pro-life and they say, well, I never thought about it that way.
Yeah.
I don't know, or wow, you've really convinced me that in that situation, it is appropriate.
There are many people in many states right now that cannot get that treatment. And a lot of it is the misconception that a termination of pregnancy is always a flippant decision, elective, and, somebody just being careless and, they're going to regret it later. And it's not. It is a procedure to help resolve even very highly desired pregnancies, to allow someone to heal and to be able to go on and, have their family. I really appreciate your sharing that, because there's a lot of people that just don't understand the nuances. And it's the politicians, quite honestly, that are making the decisions right now without your personal experience or being a physician that's helped people through situations like that. So thank you for sharing.
Yeah. Thank you for helping patients just like me.
I'm very fortunate to live and work in Washington State, where reproductive health care is very much protected and reproductive autonomy is protected. But I'm working really hard with a nonprofit Doctors for Fertility because I have colleagues that are in Texas and Iowa, Nebraska, other states where these rights are really being taken away. And it is all of our issues. I'm very fortunate to work in a state where right now everything's okay. But if this is happening in Texas, it could happen anywhere at some point. So just thank you. All right, last myth to bust. Once you have a baby, you're good. You're going to be able to have another one, right?
Unfortunately, no. So, I think we both kind of have talked about this, right? You have this baby, you think, okay, I got pregnant really quickly the first time. So when you struggle before you have a live birth, it's called primary infertility. When you struggle after you've had a child, or even 2 or even 3, it's called secondary infertility. And something that's fascinating and has come up a lot actually is that people want to know how often it happens. How common is secondary infertility compared to primary infertility? There really isn't a number. We don't actually really know how common it is because so many people who already have a child or 2 children just end up not having a third or a second. So it's never reported. But we do know that it is pretty common because life is pretty different after you have a kid. You eat differently. There are all of these lifestyle factors that also deeply affect men's sperm. So I would encourage you, if you have an existing child, definitely get him tested immediately. But it is common. And I think most people do not know that this is even a possibility. How many people do you see in your practice? Like when people ask you this question, how do you answer?
Oh, I think secondary infertility is more common than people realize, and people often suffer in silence for a very long time. There is a very typical patient that I see that they conceive their first easily. Their narrative, their story is, I've got this. I'm fertile. That's the way it's going to be. And when they start trying to add to their family, when it's not happening quickly, these are the people that often delay the longest, and things absolutely change. The biggest thing is age. Both those eggs and sperm are older if you are trying for a second. So I would say there's no way to put a number on how common secondary infertility is. I would absolutely, at a minimum, get testing if you've been trying for 6 months and it hasn't happened. Like, just don't delay. Even if the testing is reassuring, you should make sure that there's still sperm. Make sure the anatomy is okay. Things can happen in delivery and pregnancy. Most people that have a C-section, you do a uterine cavity evaluation, you can't even tell. The uterus is amazing. It heals beautifully. But there are, you do something for 20 years, you see very unusual cases. And I have seen 2 patients that had significant scarring from their C-section. They had a lot of bleeding. You kind of look at the op report and you think, okay, I can kind of see what maybe happened here. But they had no idea until we did an evaluation and helped them. All right, Leslie, any other words of wisdom or things that you'd love to share with us?
There's no one right way to start a family. There's no one right way to manage a pregnancy. And it's really about making the choices that you can control, letting go a little bit of the ones that you can't, and finding joy in the small moments where you can, and letting yourself feeling your feelings. This is like after a lot of therapy, by the way, it took to get here, but I managed my grief in very different ways than friends of mine did. And I think that it's just, we all just need to be kind to each other because you just never know what someone else is going through.
Absolutely. Oh my gosh, louder for the people in the back. Never make assumptions. All right, Leslie, where can we find your amazing books and where can we find out more about you?
Well, I love supporting local bookstores. So if you have one of those and they don't have it, ask for it. And if they do, buy it. But Bookshop, Amazon, all of those great places have both books too. I publish with Simon & Schuster, so it's pretty much everywhere. And if you want to say hi, I'm very easy to find on the internet, leslieschrock.com. I'm Leslie Schrock on Instagram and TikTok. And I love hearing from readers. It's just it's an amazing thing. It's a real gift.
Absolutely. Well, thank you so much. I really appreciate your coming on the show.
Thank you so much for having me and doing all of the patient education work you do. I point so many people to your content and just feel grateful that you're counterbalancing so much of the misinformation that's out there.
I hope you enjoyed this discussion with author Leslie Schrock. I certainly enjoyed chatting with her today. There are so many resources for fertility and pregnancy out there, but Leslie's books stand apart. Friendly approach, balanced information, and you can finish reading them feeling informed and ready to ask your team about your personal situation. Find this episode and all others on my website, drlorashahine.com. Find me on YouTube, Instagram, TikTok. I just love educating. And send an email to hello@drlorashahine.com with your own fertility story, topics you'd like us to cover, and people that you'd want to hear interviewed on the show. Thank you to my producer, Shannon Perry, and her wonderful team at Audiotocracy. This is your host, Dr. Lora Shahine. I'll see you next week when we talk all about ovarian hyperstimulation syndrome. Until then, wishing you love, luck, and pineapples.